Hello dear viewers and welcome to our program, coming to you every day on KTV2 channel Kuwait Maps. It is a variety and social program that sheds light on the out and about in the state of Kuwait, mainly the mechanism and workflow of the governmental institutions and key state bodies. With the aim of fulfilling our social responsibilities, Kuwait Maps is emphasizing the privileges and services being provided by the local agencies, as well as highlighting the information and data being acquired by both citizens and residents. In this journey, we will take you to a new destination to explore another national entity that is crucially contributing in the process of pushing the wheel of progress in the state of Kuwait. Today, we will explore Jabr Hospital. Execution period of 4 years for construction and furniture, in addition to 730 days for operation. Jabr Hospital is currently the largest medical center in Kuwait, providing services for a projected population of 600,000 and includes the latest and most advanced medical equipment. Sheikh Jabr Al-Ahmed Al-Jabr Al-Sabah Hospital is the largest single-bodied government hospital built in the region, with a full independent trauma center and a dedicated VVIP inpatient facility. Showing the interview of our first guest, Dr. Walid Ahmed Al-Bsairi, Director of Mbarak Al-Kabir Medical Area and the Manager of the Environmental Audit Department.
I think so. The main things in the Jabr Hospital and in our district, as usually, I thinking the people, which is we have it in our hospital and in our district as a medical services. We have a policy to be managed, the unique management to our client, and we try our best to provide the unique services, which is, I think so, it has been cared very well from 0 minute when the patient coming to us, our client, till when he discharged from our hospital, or to provide for him the polyclinical services, which is We have it about 16 polyclinics in our district. And the second issue is it is the unique operation theaters, the unique about the new equipment, which is we try to be following the new machineries, new system to provide as unique operation, as unique medical care.
Sheikh Jabir Al Ahmed Al Jabir Sabah Hospital was officially opened in 2018 in a distinguished event patronized by the late Emir Sheikh Sabah Al Ahmed Al Jabir Sabah. The hospital is a valuable addition to the health service sector and considered the largest medical center in the state of Kuwait, providing services for a projected population of 600,000 and includes the latest and most advanced medical equipment. Amongst its services is the largest trauma center in the Middle East. The main building of the hospital consists of 5 towering 10-story structures built on an area of 220,000 square meters, and the total area on which the whole project was constructed stretches around 725,000 square meters. The unique geometric configuration of the hospital design plays an important role to distinguish the functions of the hospital, the patient recovery, and the medical treatment. The patient surface rises embellished in a granite and patterned glass, creating a grand facade. The medical facet accommodates the diagnosis/treatment facilities, trauma center, and outpatient clinics. The treatment segment emerges as a rectilinear lattice of roof gardens and light wells. These two segments, divided by a public atrium, a medical mall, a grand glass atrium, defines the space between the patient towers and the medical departments, connecting the internal medical, surgical, and exam rooms to every recovery rooms of the inpatient towers. Every inpatient room is designed to accommodate panoramic views of Kuwait City to improve healing. The hospital has one of the largest trauma centers in the Middle East, with an independent ICU reconstruction/operation facility with a devoted ambulance drop-off/parking for over 45 ambulances, a committed helicopter pad on the roof, and a parking lot accommodating some 5,000 vehicles. The dental center stands alone, accommodating 65 clinics and 7 dedicated X-ray rooms, laboratories, a central sterile supply, administration, and support spaces. The hospital, in addition, houses a complete conference center, auditorium, medical library, and classrooms.
We have, as I said, is 20 theater rooms. And each theater rooms is a specialized, an example for ophthalmology, for ENT, for orthopedic surgery, for neurosurgery, for general surgery, for plastic surgery, all this type, and urology. And we've been trying to use the latest technology. It is robot surgery in our hospital. And I think so it has been used in gynecology, which has been cooperated with general surgery. They make it very unique surgery recently. The cooperation between both specialties, it's been subside a major problem with one client which is coming to our hospital. And I think so the unique in our hospital is there are some cooperation between each other, and there are no surgery done only after when the surgeon and other specialty is being discussed. And just recently, and I hope so in the next 2 months, will we have a cooperation even surgery with the dental specialties in, which is close by to our hospital, to have all the muscular, teeth surgery for the surgery which is related to the dentistry.
the recruitment of a distinguished physicians and health allied members in the department, and the exquisite planning of providing policies and guidelines that will reflect in the service of the department has been the main framework, or has provided the main framework for the department. And this was seen as the result of this was seen as the hospital was assigned to cover the COVID pandemic with a surge of patients, so children and their families being admitted in large numbers in the department. The care provided matched the standard of international and sometimes even exceeding the international standards of excellence of care for children and their families. After the pandemic, the department continued to advance in many sectors, providing different sections throughout the department, starting with the emergency department, and which provide care to infants and children up to the age of 12. This care is the initial or the first step of providing emergency and advice for families and their kids with their own concerns. Then there was an expansion of the department into 3 wards, each ward containing 27 or 28 rooms. Of them, the majority are private rooms with specialized rooms for special cases such as infectious cases, and with each room has enough physical facility and care provided from nursing and the doctors to provide kids and their families with not only the needed medical treatment, but also the comfort and psychological meeting the psychological needs of the kids and their families throughout their stay in hospital. So the department future plans is to meet the hospital plans as well as Kuwait Vision 2035. And with that, there are challenges including the expanding of the population and the need for more specialties, as well as meeting the educational needs of doctors and possibly Kuwait University. So there are many plans with the further expansion of the departments, recruiting more doctors that are capable of providing different care and service to the patients, as well as liaising with Kuwait University in the future and continue the liaison with KIMS or Kuwait Institute for Medical Education, providing not only the best care for the patient, but also an opportunity for educating our young doctors and medical students in the care of children and their families.
Until then, stay tuned for more topics and updates that concern the society and benefit Kuwaiti citizens and residents as well.